Whenever I am sort of speaking for Mrs. Illinois, it sort of comes along with that different audience that may sort of want to know about mentorship or how to get into pageantry, but it's a different audience that can sort of tell them something that may be life-changing to them or something that they haven't felt comfortable telling others. Because oftentimes people will say, oh, I have epilepsy, or I have a nephew or a niece or a cousin or aunt or whatever, and then they feel so much more welcome because somebody else will usually say, I have epilepsy, touched my life in this way as well.
Before we jump into this episode, I want to invite you to join the What the F community to hear even more conversations that will make you laugh, cry, and feel more connected. All I'm asking you to do is click on that subscribe button that's right on your screen. I love your support, and it is so inspiring and amazing to see all of your comments. Thank you so much for subscribing. It means the world. Here we go. Hey guys, welcome to What the F. I'm so excited about today's guest, but before we dive in, I'd like to thank Neurelis and SK Life Science for believing in What the F podcast and for making conversations like this possible. Today, my guest is Dr. Takijah Heard. Thank you so much for being here.
Thanks for having me.
I am so excited to talk to you because, I have an intro written out for you because I just want everyone to know who we're talking to, and the intro doesn't even cover everything. And it's 4 note cards long. So everyone, sit tight and listen to the amazing Dr. Heard, who is the Director of Pediatric Neurophysiology at North Shore University Health System here in Chicago. She is also on the board of the Epilepsy Foundation of Greater Chicago. She has earned a gazillion awards, and one of them I'm mentioning here is the 2022 Physician Mentor of the Year by the I Am Able Foundation. She is featured in a book turned into a documentary called Against All Odds, Celebrating Black Women in Medicine. A longtime epilepsy awareness advocate, including features on NPR. Work in Texas and Chicago and abroad in Zambia and Tanzania. Also the 2023 Mrs. Illinois, which is so much fun to say. And I'm so happy you're able to come in studio because you live in Chicago, but you are born, bred, everything in Chicago, right?
Yes,
well, not quite everything, but because you've done so much work, but that's kind of where you got your roots.
Right.
Is that fair to say?
Yeah.
Okay.
Agreed.
Yeah.
So born on the south side of Chicago and stayed here through elementary school, and then not too long thereafterwards, mainly was raised in Texas. My dad's job moved us to Texas, and so stayed there through college, but then came back to University of Chicago for medical school. Went a little bit further south to Christ or Hope Children's Hospital for the beginning of the pediatrics residency, and then moved over to Boston to do the Harvard residency at the Harvard hospitals.
No big deal.
Yes.
Went to Harvard.
And then slid back down to Texas, initially in Houston. That's wherever I did the NPR radio interactions. Then went to Cook Children's, that's there in Fort Worth, which is closer to where my family lives. And then made my way back to Chicago because I love it. It's my favorite city. And here at North Shore for the last 7 years.
Wow. Yeah. Well, first of all, congratulations. And second of all, thank you for all of the work you've done. And that's really what I want to talk to you about is your passion for epilepsy awareness advocacy, because it's so strong and so thorough and literally across the world. So where did that start? Where did that begin for you? When were you like, this is what I want to do and I'm going to really fucking do it?
So it sort of became my passion to become a doctor because Bill Cosby on The Cosby Show was a doctor. He had a beautiful family. And so decided I wanted to be a physician for that reason. And then at University of Chicago, between your first and second year, you have to do some type of research project. And I recognized that I had to do something that I was a little bit nervous by because I didn't want to be very nervous whenever I actually happened to see a seizure on the wards. So ended up doing my research in pediatric epilepsy.
Wait. Wow, sorry. So you wanted to see something that made you a little nervous.
Right. So that whenever I'm on the wards, I'm getting judged by it, that I perform appropriately. So I didn't want to freak out, faint, get very nervous.
Yeah. Well, I appreciate that. I appreciate the honesty. I appreciate being if I don't know what to do, I'm going to be nervous to see it. Yep. Right. And not sure what to do. And also I think that's so human and relatable. Doesn't everyone kind of feel that way? What do I do when they're, Wow. Okay. That's so amazing. I'm sorry to cut you off, but I'm going to stop for these beautiful moments because they're going to happen a lot.
Yeah, so I was, nervous and curious.
Yeah.
And so ended up doing that research, fell in love with the whole thought about epilepsy. Kids can have epilepsy, sort of in the womb, or they can have it, later on in life. Mm-hmm. They can sort of be very, very normal and have a full life. And I wanted to sort of celebrate that piece. Or if you have, complications and complexities of epilepsy, that can exist as well. So if you're an epileptologist, you have the full breadth of, kids that are very what considered to be normal. To those that are, very devastated and or debilitated with their epilepsy because they have other neurologic issues that comes along with it. Mm-hmm. And so you have that that large sort of spectrum, and I sort of appreciate that as an epileptologist.
Yeah, well, what is that like as an epileptologist? Because I feel like in some ways, and maybe I'm wrong because I don't know anything about anything, but like you're treating some of the most harder patients because they're unable to communicate, right? I mean, children they just don't have the skills yet. There's nothing wrong with them. It's just what a kid is, it's just like, I don't know how to communicate. So it's like, what is that like when you're treating such a spectrum of epilepsies, and then like with a spectrum of ages that are like, can't really explain how they feel?
Well, I mean, within pediatrics, you're going to end up sort of having to do a lot of observations.
Okay.
Kids are sort of brilliant and resilient in the sense that whenever they're doing great, they're running around, they're running away from you, they're playing.
Yeah.
And obviously, if they're not doing those things, something's a little bit different.
Okay.
And so a large portion of being a neurologist is symmetry. Is everything that's happening on the left side happening on the right side? Mm-hmm. And so oftentimes we can tell a lot by, how they sit, how they walk, how they move, and certain things they do and don't do.
Yeah. Mm-hmm. Okay. So, that's just gives such a different perspective, because here I was thinking like there's so much, I'm just projecting my own experience when I go in and talk to my neurologist. I'm like, this is what's happening. And I explain. And it's so funny because the first thing she says, well, did anyone see it? Mm-hmm. Right. Mm-hmm. And for so much of my epilepsy experience, the answer was no.
Yeah. Yep.
Right. But with children, generally, am I to assume that maybe someone sees it? Or?
Right. Mothers, grandparents, aunts, uncles, daycare workers are staring at the kids. Those kids are usually around those people for longer periods in time than teenagers and adults, and so oftentimes they sort of notice that weird thing that, the 6-month-old is doing.
Sure.
The 6-year-old is doing.
Okay.
And so that's usually sort of captured in a way in which somebody can sort of explain it, and then from there sort of move backwards. And then the other thing is the sort of the age of us having phones all the time. And so we can oftentimes, sort of videotape it and then show me, and then we can sort of get a general idea of what these episodic happenings are, identify if they're seizures and epilepsy or not.
Okay. Yeah. And saying that an epilepsy or not, because I'm not a parent, but I can't imagine what that would be like to be like, oh, I think this is different. I think this is weird. I think this is not supposed to be happening. Yeah. Do you find that happens a lot when or what would you say to parents that so that they're not overly, I don't know what the word is, but overly nervous about something, or what to look for? Or is there something is there even a thing like that where you can be like, look for these things?
Well, not necessarily look for these things, but whatever as your mom or your sort of, your radar sort of peaks up to sort of say, this is weird. Okay. Because, a lot of people have a very stereotypical thought about what seizures are. Jerking and shaking, foaming at the mouth.
Right.
That's usually not true for kids.
Yeah.
Oftentimes it's sort of something that happens on one side of the body that doesn't happen on the other. Something that sort of happens rhythmically. But oftentimes I'll ask them to see if they can repress the movement. So if it's a shoulder jerk or a leg jerk, can you hold it down to where it goes away? Seizures cannot be held down. If it's coming from the brain, it's going to jerk up under your hand. And that's something that sometimes if it's long enough, you can actually capture it.
Yeah, totally. I've never thought about that before. Wow. God, no wonder you're so good. Been here for 5 minutes and I just feel so educated right now.
Education is key.
Yeah. Well, and that's kind of what I wanted to ask you about, because there are so many doctors who, that they're doctors and they do their thing, and that's amazing. It's great. But then you're a doctor who's like, I'm going to go above and beyond in my world, in my sphere, and start advocating for the people that have the thing I treat. Yeah. Why do you do that?
Because I think education is key. Getting the right education, knowledge is power. And so oftentimes people were for example, the reason I ended up going to Africa is because in African culture, sometimes it's taboo to have epilepsy. Sometimes these people have to choose between their tribe and their culture and their child. And so oftentimes there's sort of thoughts of, spiritual beings being in that person during the time that possession happening during their seizure. And so I just wanted to make sure that that was not that education was there so that these children and these families can stay together.
What was that experience like?
So it was very different, but the biggest thing is sort of, the education. You go, there's oftentimes a language barrier, there's a cultural barrier, but, the biggest thing is trying to get that education piece in there. And oftentimes as a pediatrician, you sort of figure out a way in which you can sort of speak to the family in a kind way to sort of get your point across. They're there to sort of help their family member and doing what you can to make sure that you can get across to them that, epilepsy is something that can happen. It's not something that you've done wrong. It's not, voodoo or something that's taboo. It's nothing to be ashamed of. It's nothing to ostracize yourself from your tribe, your family, your community, and it can be treated.
Yeah. Yeah. And I was surprised to learn just how common that is even, even stateside.
Oh, absolutely.
Yeah.
So same.
Yeah. Where there's definitely I think it's not as, I can't think of the word, but not as
taboo.
Yeah, thank you. Not as taboo, but maybe there is a kind of a stepping back from a family member.
There is.
Yeah.
There is. And then same thing with playmates. Sometimes the parents don't necessarily encourage interacting with a child that may have epilepsy. Yeah.
So
having
hard.
to deal with, the possibility of the epilepsy happening in their care and feeling uncomfortable. And sometimes the education is that it's contagious.
Yeah.
So that awareness will allow these kids to have a very normal life.
Yeah, absolutely. And last season, we had on Tony Coelho, the writer of the American Disabilities Act, and his story is the same, where his parents believed that, he was demonized, or he had a demon inside of him, and so they wouldn't even tell him that the doctor had said he had epilepsy, kind of thing. And it's just even those, it's just, and you kind of understand it. I don't know, as a person living with epilepsy, I'm I could see how someone would think a demon is inside me, it's not, I get it, but it's just so amazing to have people like you out there being no, that's not the case. So what do you think is one of the things that you run into the most that seems to be the education, or what are the few things that you feel the education obstacles that need to be overcome the most in the world that you treat patients with epilepsy?
That it can be it's something that goes into remission. You may get that diagnosis of epilepsy, and sort of in the pediatric world, especially, you can be seizure free for 2 years, and we consider you being in remission, and you can come off of meds and sort of lead a very, very, sort of normal life and not necessarily have to come see an epileptologist on a routine basis. Previously, it was during the epilepsy sort of plan of care, you wanted to put something in their mouth to hold down their tongue.
Yeah.
But we are not putting any things in our mouths. Oftentimes it'll cause them to sort of chip their tooth will go into their lungs, and us as the physicians have a little bit more work to do. So the biggest thing is sort of trying to undo that. And then you're just recognizing there's another medication that's used as a rescue medication, similar to an EpiPen. If we have a seizure, it lasts longer than 5 minutes, we can give this medication and stop the seizure while we're waiting for 911 to come help us.
And even I'm just learning more about rescue meds too, that you can take them when you think a seizure is coming on, and it can stop a seizure, which is just amazing to me. I know people, I have friends who use them, I haven't tried one yet just because it is a little nerve wracking. But I love that concept. Yeah. Okay. But the spoon thing, or the thing in your mouth, do you know where that came from? Do you have any idea how that started?
Not fully, but I do feel like there was a question of you swallowing your tongue.
Oh, that's right. Yeah.
And so that was the thing. And so you don't really swallow your tongue. Your tongue is actually attached. But if you
do, we all hear that? You cannot swallow your tongue.
It is attached. But if you fall back on your back, your airway will close like a straw, just because of gravity and the fact that you sort of don't have control of your airway.
Okay.
And that closing of your airway like a straw sort of can decrease the amount of oxygen that you receive. And so that's why we always ask to lie them on their side.
Okay.
It allows the airway to remain open.
There we go. And don't put anything in our mouths.
No,
yeah.
Nothing.
Yeah. As far as Chicago goes, which,
it's my favorite city.
I love how much you light up when I mention Chicago. It just makes me so happy because I feel the same way about this city too. What do you feel first, because first I want to talk where you're at in community, what we could do more in Chicago for epilepsy awareness. And then I want to go a little bit bigger, but let's talk about Chicago first. What's your thoughts there?
So I appreciate the fact that Chicago is uniquely one of the few cities that has this large number of medical schools within the city. You know, there's a lot of states that don't have this number of medical schools in the state. But the city of Chicago has many, many great, well-renowned medical schools within the city, which means it has that same number of hospitals, if not more. So I appreciate that sort of being something that sort of allows for people to have access to epileptologists and then have access to things called EMUs, which is epilepsy monitoring units, for them to explore their epilepsy to try to see if it's focal enough or in a portion of their brain for them to possibly do surgical resections of that bad area that's only causing seizures and sort of lead a much more sort of normalistic life with less medication and less seizures.
So can I ask, like, just from a doctor's point of view, because I've had 5 EMU stays, and they were all incredibly frustrating. I know, like, and I think a lot of people experience that with an EMU stay, the frustration of it. And I always have to remind myself why my doctor is
doing this.
Yes. So, but I would like our audience to hear from a doctor why EMU stays or EEGs or whatever those things, whatever we're doing like that, why those are important.
Yeah.
Even if we don't catch a seizure.
Yes.
Because I feel like I've had 10 EEGs, 5 of them are in the hospital in EMU, and I've caught 1 seizure. And every time I didn't catch a seizure, I felt terrible. I felt awful. I felt ashamed. No. And every time the tech would be like, that happens all the time.
It does.
Yeah.
It does.
Okay. So I would love if you would explain that for people like me and anyone listening.
So EEG is a dynamic study that lets you know what's going on at the brain during the time it is being recorded. So it doesn't leave like a full record of you having had a seizure yesterday or a week ago. It's very similar to taking a picture. So if you take a picture of you and you're smiling, it doesn't mean that you weren't frowning the moment before or the moment after. But the beauty of the EEG is
wait, I'm so sorry. Can we pause? That's so beautiful, because it's just taking a picture.
Right.
Doesn't mean you weren't frowning the moment before, the moment after.
Right.
I think that's so, because I think just again, patient perspective is just sometimes you feel crazy. You're like, am I really having seizures? Maybe I'm not, because the EEG didn't catch it, the magic EEG.
Yeah.
But it's just a photograph.
Right. Of that moment.
Yes.
Yeah.
Beautiful.
Yeah. Yeah. And so sometimes people will have a very normal EEG and definitely have epilepsy, generalized epilepsy, frequent epilepsy that needs to be treated with seizure medications, and will constantly have a normal EEG. That's very, very common. The EEG background without a seizure sort of tells us our interictal activity. Ictal activity is the seizure. Interictal is in between. So will you possibly have abnormalities that lets us know that you have the likelihood of having seizures? So, for example, if you read music, a normal EEG is an EEG with just the scales. No notes, no songs, no cadence, no rhythms. But an EEG that's abnormal is an EEG that may have spikes or notes or a little bit of a cadence, but not necessarily a rhythm that sort of pulls everything together like a song, which is a seizure.
Wow. That is such a good analogy.
That's what I use in hopes that people can sort of understand it, because the squiggles is not something that a lot of people understand. That's on the EEG.
No, I don't even read music. Not for lack of trying, but I love that analogy, that it's the song or it's not the song, or, oh my God.
Yeah, or the fact that you have some notes. So the notes lets me know that at this moment you have notes, which if it sort of all came together in concert with a cadence and a rhythm, that you could produce a song, which lets me know you could produce a seizure.
Wow, that's so beautiful.
Yeah.
Oh my God. Okay, so we've talked about Chicago. Now what about in a broader scale, which I know is such a weird question because there's so many epilepsies, there's so many types of patients, there's so many variables, but in a broader spectrum, what do you feel like that we could do more of or have more of, as far as, we'll start with here stateside?
So stateside, I think that it would be amazing if everyone had an opportunity to have access to a neurologist, and more specifically an epileptologist. I think maybe when I was in training, there might have been a single neurologist and pediatric neurologist in the state of Iowa. And then there might have been a single pediatric epileptologist in the state as well. Wow. So that means, a lot of people had to do a lot of traveling just to come see this person. And then they would be, overly booked. And so that may mean that there was a huge delay in you getting your care. Yeah. And so oftentimes, as with anything, the earlier the better, especially when we're talking about sort of young brains or pediatric brains.
Yeah. Well, and just to your point about Chicago, that's where I feel so lucky because, it was which epileptologist do you want? And I didn't realize until I was a few years into my epilepsy journey that that is such a luxury to, if you don't like one at this hospital, just hop over to the next one. It's like, to me, I had no idea how lucky I was until I started, getting into this community. And I think that's a really, really good point. You also teach at medical school, right? Okay.
Yeah, medical students and residents.
Yeah. So what is that experience like with, students today? Like, and how does it feel to be on the other end when like you originally started this because you're like, I don't know what this is. I want to be prepared and ready. And now you're on the other end teaching those students who, maybe feel the same way.
So I think the biggest thing is, again, knowledge is power. Education is key. And so, I wouldn't have been here had I not had a mentor, a teacher that got me here. And so I sort of definitely try to give back in me mentoring, Mentor of the Year for the I Am Able Foundation.
Which is amazing.
Thanks.
Yes.
And then anytime
I warmed my heart when I was like Googling you and I was like, oh, come on. Of course. Of course she is.
Yeah, so I do what I can to make sure that I can teach others, especially about epilepsy and seizures. Like going through education as a pediatric neurologist or within medical school, neurology is something that doesn't get a lot of exposure. And so I wanted
didn't
to
know
make,
that.
Yeah.
Oh, okay.
Yeah. So oftentimes I sort of want to make them know that, neurologists can be, sort of a fun career path that I think sometimes gets overlooked. And so whenever I get the opportunity to sort of teach them about epilepsy, I definitely try to teach them about epilepsy or neurology in general.
Well, you've definitely made it fun. I mean, I'm sure a lot of people have seen the baby brain doc, not hashtag, Instagram handle. Yeah, which I just love because you do make your career fun, and it truly from the outside, like, I'm like, wow, it looks like it is fun to be a pediatric epileptologist, and I love hearing that. Did everyone hear that? She loves a job, okay? Loves her job. Just because we need to hear more and more people in neurology, epileptologists saying that, like, I think just to make it a little bit less scary for people who are seeking care.
Yeah, absolutely.
Yeah. And I completely lost my train of thought because I just fangirled out again on you. But okay, so not only do you have baby brain doc, but also you were 2023 Mrs. Illinois, which is so fun. I can say I don't think I've ever had a doctor who was Mrs. Illinois that I know of. Who knows? But can you tell me like about that experience? I remember when we first met, you had said like a friend told you to signed you up.
She put in the registration because she knew that I would not have done it personally. Growing up, I have 3 older brothers, and I was truly a tomboy playing sports through college. And
what sport did you play?
So track and basketball.
Oh, nice! Look at you. That's awesome. Wow. Okay.
And so I never would have signed myself up for it. So whenever she, sort of even mentioned it, I was like, oh, so humbled. Oh, thank you. I appreciate you even calling me pretty. Thanks. Yeah. And so then they called and sort of said, are you sort of ready for this? And I was like, you know what? Thank you. I appreciate it. But then they called the second time. And I was just like, Lord, are you telling me something? And so I went, and I am now the crowned new Mrs. Illinois 2023.
Oh my God. Well, congratulations. Like, what was that experience like?
And so, that happened on Father's Day. And so then in August, we ended up going for the Mrs. America. And so that was in Las Vegas in August. And so it was just a completely different lifestyle than what I'm used to, sort of waking up early, getting, beautified and getting pampered. And, you learn the different etiquette. All careers have different etiquettes of things that you should know. Totally. Experiences that, sort of make you more prim and proper and poised and prepared. And so, you just would see, all these, beautiful ladies that have different platforms. And it was great for me to be able to marry my, sort of career platform, my passion into the platform of being Mrs. Illinois with epilepsy awareness.
Yeah. Can you speak to how you did that?
So that was the platform that I had, made sure that, the fact that me being an epileptologist, so I could sort of utilize that. So oftentimes whenever I am sort of speaking for Mrs. Illinois, it sort of comes along with that different audience that may sort of want to know about mentorship or how to get into pageantry, but it's a different audience that can sort of tell them something that may be life-changing to them or something that they haven't felt comfortable telling others. Because oftentimes people will say, oh, I have epilepsy, or I have a nephew or a niece or a cousin or aunt or whatever, and then they feel so much more welcome because somebody else will usually say, I have epilepsy touched my life in this way as well.
Yeah, well, and again, thank you so much for doing that because it's just a way to normalize the epilepsy experience, and just by talking about it, putting it out there and just making it less of a like, oh my God, sort of thing, and just like okay, just that reaction instead. Okay, before we close, I would like to ask you 4 questions.
Okay, I'm ready.
And they are not related to anything in this conversation whatsoever.
Okay. I'm ready.
Number 1, what are your favorite types of books to read?
Ooh, so I'm a part of a book club with some ladies that's here in Chicago. I enjoy books that are more of an adventure. Sort of, they sort of have, places that you sort of can go to. So a little bit of a book that sort of tells a story of places that you can sort of actually visit. So I usually enjoy those types of books.
So you feel like immersed in a different place sort
Correct.
of thing?
Yeah.
Oh, I like
era.
that.
Like the Bridgerton type of series, like
God,
a different era.
Yes.
Yes.
I've rewatched that series so many times.
Yes. And all the spinoffs that come from that.
Yeah, so good.
Agreed. Yeah.
Number 2, what's your favorite thing to do in Chicago? Or one of your favorite things?
To do in Chicago is whenever I have any guest or company that comes in, is to show them Chicago. So whether that is, sort of the Willis Tower or the Hancock Building or Navy Pier or, just going up and down Michigan.
Yeah.
Yeah. So
nice.
I think just sort of, showcasing Chicago and all the highlights that exist within it, because I think that it doesn't get the highlights that it really needs.
I agree. Yeah. Number 3, if you could tell your younger self one thing, what would it be?
Everything's going to be all right. Yeah. Like as a younger person, you just sort of feel like you have so many different things that you're trying to accomplish. It's not going to work. Yeah. That everything's going to be all right. Everything happens for a reason. Very similar to like Slumdog Millionaire.
Oh,
all
great
of the different,
movie.
Yes. All of the things that he had to go through. It sort of all falls together for your triumph at the end. So keep going.
Wow. Even I felt like a wave of relief when you said that. I was like, oh, thank you. Okay. And number 4, what's one thing you do to practice self-care?
So usually like some alone time. Yeah. So alone time, some time to sort of think back and reminisce on the day. What you have accomplished, what you will accomplish the next day, and sort of that's sort of like a daily thing. What I have accomplished today and what I will accomplish next day.
I love that. Just doing a little reflection, taking some time.
Yeah.
That's beautiful. Yeah. Oh my gosh. Well, Dr. Heard, thank you so much for being here. Thank you so much for the conversation. Thank you so much for the work you do in advocacy and just being a fun, wonderful, beautiful, positive person.
Thank you. I appreciate you having me.